Hello and welcome to the first of 3 educational videos on how to implement telehealth into your PT practice. I'm Tom Musgrove. I'm a student physical therapist at Sacred Heart University, and I'm just going to be taking you guys through a couple of key elements of implementing telehealth into your practice, as well as some safety considerations that you're going to need to take part when you're treating patients via telehealth services. So let's get on with it. So first and foremost, it's important to establish a definition of what telehealth actually is. So telehealth is the use of telecommunications and information technologies in order to share information and provide clinical care, education, public health, and administrative services at a distance. It's very important for individuals, especially in this COVID-19 crisis, who are unable to access care due to their vulnerability, and as well as really helping the clinic that you're in, because it's going to help save the clinic a little bit of money down the road instead of having to take the extra effort to go to the individual's house. So this is a good way that you can incorporate telehealth for a business aspect as well as for a patient safety aspect. Next, we're going to get into some of the benefits of telehealth services and the benefits of incorporating it into your treatment plans. First and foremost, it's going to reduce costs for the clinic. Instead of having PTs go out to the patient's home, it's going to save the clinician money as well as the clinic money. So that's a very important aspect, as well as also down the line, once reimbursement is in place for telehealth, it's also going to save the payers money. So it's kind of a win-win situation for everybody. It's also going to increase access to patients who live in rural areas, as well as patients who are too vulnerable to be seen in person. This is very important because as physical therapists, it's important that we get access to all the different patients that need our assistance. It's also going to decrease the health disparities around the world. It's very important that patients have access to wellness and being in contact with their physical therapist throughout the course of your treatment, as well as once they develop a home exercise program, having that open communication with their physical therapist is going to be very important for decreasing mortality rates as well as getting an overall healthier population. And finally, we need to consider that this is a great element of growth for the physical therapy field. The more that we're able to treat patients via telehealth, the more access that people get, and the more growth that the physical therapy field gets as well. So those are some important benefits and some reasons to consider implementing telehealth into your plan of care. Next, it's going to be important to consider the payer information and what's covering telehealth and what's not covering telehealth. To start off, Medicare does not necessarily cover all telehealth services. Only in some states is it covered. Right now though, as a result of the COVID-19 pandemic, telehealth is considered an emergency coverage for those who can't access in-person services. That's a benefit because the more clinicians that start using telehealth, the more willing Medicare will be to cover it in the future. In terms of Medicaid, Medicaid does cover telehealth in certain states. You're going to need to check out which state you're in order to see whether or not they do cover it, as well as certain private payers. They also do cover telehealth services. Again, you'll need to check with those private payers, but there are a lot of private payers currently that cover telehealth services. So if a patient comes in with certain insurance, you're going to need to check with their insurance to see if it's covered before implementing the telehealth for that patient. And then finally, we can collect out-of-pocket payment as well for these services. It may be a little bit of an increased cost for the patient initially, but the more that we use telehealth and the more that the patient has access to care, they can decrease healthcare costs for them down the line. So it is important that we do have a way of getting reimbursed for the services, but also it's important to consider that no matter if it's a little bit more expensive, it is worth it to the patient. Next, we're going to have to discuss the actual implementation process of incorporating telehealth into your plan of care. First and foremost, you're really going to want to check in with your State Practice Act and see what is covered and what is not, and what is allowed in your scope of practice under telehealth. That's going to be number one, and it's going to be related to the state that you're in. Many states have different laws regarding telehealth, so keeping up to date with that is going to be important. Next, you also need to consider whether or not you're a part of the PT Compact, because that'll influence who you're able to treat and who you're not able to treat. Currently, there's a lot of states that are a part of the PT Compact, which allows telehealth services to be offered to people across a different state border. That'll allow you to increase the patient population that you're able to see, could bring in more revenue for the clinic, as well as increase your outreach to those patients. Next, you're also going to want to check the state and federal laws. That's going to be important as well to, again, see based on what state and what the federal government are saying you're allowed to do under telehealth. You're also going to want to make sure that you're covered for telehealth under your malpractice insurance. And that's going to be usually through the clinic, or if you have individual malpractice insurance, you're going to want to check to see if you are covered. Next, there will be policies and procedures that are developed by your clinic that relate to telehealth, so you're going to want to make sure that you're abiding by those. You're also going to probably go through a clinician competency course that's going to go through whether or not you're adequate enough to participate in telehealth. And that is kind of the purpose of this course, is to give you that competency so that you can go out and utilize these services. And finally, patient outreach is going to be the last thing. You're going to outreach to your patients and see which patients are interested and which patients are not, because this, of course, is a voluntary basis and you do not have to force your patients into doing this. This is more if they prefer to do this instead of seeing you in person because of maybe infection, maybe too far of a car ride, or for you, or anything like that. So just some things that you need to consider prior to implementing and staying up to date on all the regulations and policies regarding telehealth from a lot of different angles. Staying with the trend of policies, you are also going to want to stay up to date on the policies regarding HIPAA requirements under telehealth. So under Title II of HIPAA, under the Privacy and the Security Acts, there is no actual mention of telehealth. That means that all of the requirements under HIPAA actually apply to telehealth. So the in-person requirements for HIPAA also apply to telehealth. And that's very important, but there is one additional element that you do need to be on an encrypted network, making sure that the security and the privacy of the patient is taken into consideration every time that you meet with them. This is easy because the system that you actually have at your clinic, the HRS system that you use on a regular basis on your tablets, has an encrypted connection and encrypted VPN. So that will not be a concern, but making sure that you're following all HIPAA guidelines is going to be important, as you would with in-person sessions. Another thing to consider about telehealth is the patient population that you're going to be seeing via telehealth. Now, there's no actual law around it or policy around it, but there should only be certain patient populations that require telehealth services. Those that are too far away for you to access, those that are too vulnerable and could potentially risk infection transmission. Those are two of the main reasons why you might want to treat a patient via telehealth. So it's important to consider that not every patient that you treat is going to be eligible for telehealth. Making that clinical decision is really up to the therapist, but it is important to consider because under Medicare's guidelines, they're only going to cover certain types of patients, and this applies to private payers as well. There's only a certain type of patient population that they're going to cover and actually pay for and reimburse for under telehealth. So you need to take that into consideration, and it's really a clinical decision that the clinician is going to have to make. Next, we're going to be going into some of the considerations that you might want to take in terms of patient safety during each telehealth session. In order to maintain a seamless transition from in-person care to telehealth care, the HRS system has a telehealth capacity. This was mentioned previously in the video because it is an encrypted server, so you are able to get that security with the patient. And it's going to be a seamless transition, which is very compatible with what all the clinicians at AlaraCare are currently using. So that's going to make this quite easy for you to transition and incorporate into your daily practice. The next thing to consider is the camera setup. Now, it's very important if the patient is using a phone that they put it in horizontal mode. That'll give you greater ability to view their environment as well as view the patient as a whole. And that's another important point as well. You want to be able to see the entire patient for safety considerations, as well as making sure that they're as safe as possible, as well as making sure that they're doing the exercises properly. You're also going to want to make sure that it's set up in a certain environment that is safe, but we'll get into that in one of the later segments. Another important element to take into consideration is going to be the lighting. Now, it's very important that the patient has lighting set up behind their camera so that light is reflected on them. This is important for a lot of reasons. Making sure that they're as safe as possible in their environment, making sure that you're able to actually see their face. Now, that's important for patient safety, patient exertion, and making sure that they're not overworking themselves. It's also going to give you greater visibility so that you can see whether or not the patient is doing the exercise properly and doing it as safely and effectively as possible. Sticking with the trend of monitoring the patient during a session, it's going to be very important that you monitor their exertion throughout the process of a telehealth session. Things like monitoring their visuals and their actual facial expressions, while also asking RPE very frequently. This is a very easy thing that we can do as clinicians in order to assess how hard our patients are working. So on a scale of 1 to 10, how hard is the patient working currently? That'll give you an indication as to how difficult the exercise that you're giving is, whether or not you need to progress or regress the exercise, and it's an easy way to get immediate feedback from the patient. Next, you're going to want to check their environmental setup. Prior to starting the session, you're going to educate the patient on what to bring with them, where they want to be, and making sure that they have enough open space. It's preferable that the patient is on a carpet or a rug for better traction, and you're going to also want to make sure that the patient is in athletic clothing, wearing shoes, and having nothing in their environment that could potentially lead to a fall or any risk of injury. These are going to be obviously very important for maintaining patient safety, but it's an easy thing that you can check at the beginning of the session to prevent any potential complications. In the event that any complications do arise during a telehealth session, it is very important that you are prepared for any emergency that may happen. This involves getting the contact information of a friend, family member, or caregiver. Even speaking with the caregiver while they're in the home with them could be important, but also making sure you have access to all the emergency services that are located in that patient's area. Phone numbers of EMS as well as fire department and ambulances is going to be important just in case something happens. This way that you're prepared, if anything happens throughout the course of your session, you can make a call quickly and rectify the situation. Finally, for those patients that are in a more vulnerable population and need a lot of assistance in order to get their treatment session complete, it's going to be important that they have their caregiver there with them. We'll go into this a little bit more in depth in some of the later videos, but having a caregiver there to assist them in things like gait training or things like doing certain transfers and these types of exercises, it's going to be important that they have a caregiver there with them so that they're as safe as possible, because obviously the PT is not going to be there assisting and monitoring safety. So taking the caregiver through a quick educational course on how to monitor the patient, how to assist the patient, and how to keep the patient as safe as possible will definitely be in your best interest, and is definitely something that you should do prior to working with the patient. That concludes our first educational video on telehealth implementation. The next couple videos, there will be 2 more videos in the series, one going over gait training and the other one going over resistance training and how to progress and regress with some strategies on how to approach both of those different things. So with that being said, we hope you enjoyed the video and we hope you enjoy the rest of the educational course.